Dr. Kyle, let's start with the basics. What is Alzheimer's?
So this is actually not as fundamentally answerable as one would think. What's actually happening in the brain, we know bits, we know pieces. Everyone knows insulin is linked to it. There seems to be these amyloid plaques. So when you look at a brain upon dissection or on an MRI, we've got some tangled things, we've got some protein buildup, but there actually has not been a consensus on what's really happening or how this seems to work until there's a doctor by the name of Bredesen who's been practicing since the early 90s in UCLA, who's done extensive research on what's actually happening with Alzheimer's disease. He's published a book, once again, Dr. Bredesen, who we think is really going to push revolutionary new ideas and treatments for this condition. And he actually has one of the first workable models for what's really happening with Alzheimer's disease. So what he really looks at is Alzheimer's disease. The difference between Alzheimer's disease and a regular brain is all about how we're cutting a certain protein. There's a protein he's named APP, which is called amyloid precursor protein, and we get amyloid beta, the famous thing that causes plaques in Alzheimer's, from this protein. And basically what's happening in Alzheimer's patients is they cut this protein into 4 pieces, one of which is amyloid beta, and then there's 3 other pieces. They all promote the destruction of brain connections, cell death in the brain, and pruning of the brain, versus if we cut it into 2 pieces, we promote cell growth, we promote brain growth, we promote synapse growth. So what he's really projecting is the difference between an Alzheimer's disease patient is they are cutting this APP protein into 4 pieces, which is bad, and a healthy brain cuts this into 2 pieces, which is good and promotes all the healthy brain function that we really want to sustain.
Does he provide an opinion on why the brain is doing that? Why is it being cut into 4 versus 2?
So when he initially discovered that this could be the physiology behind Alzheimer's disease, because although this disease has been documented for a long time, it's hard to really aim at treatment when you don't completely understand what's happening. Aiming at blocking amyloid beta has been what people have been chasing for a long time. There are over 200 drug trials trying to block amyloid beta to help Alzheimer's disease. None of them have worked. And so we really think chasing amyloid beta by itself is an empty place to go. He also has come to this conclusion by just looking at the clinical trials and going, this is not working. Why isn't it working? It seems to be part of the picture, but definitely not the whole picture. So what he and his team started to do is they said, okay, if it's not just about amyloid beta, but about all 4 pieces of how you cut the APP protein, what is everything that affects how you cut this protein? His team has identified over 36 factors, and he says this in his book. We have 36 things that push it one way or the other. So if we have it one way, we promote cutting it into 2 pieces. If we have it another way, we promote cutting it into 4. And he says, it's like having 36 holes in your roof. And so what his program is really designed to do is to assess through testing, through examination, through evaluation, how you're doing on these 36 factors, and then starting to plug the holes you have, starting to repair your roof. And what he says over and over again is just plugging one hole in a 36-hole roof does not stop enough of the leaking to dry out your house and make your house healthy. So what we're really doing here is it's just an organized way to evaluate everything we've discovered affects if you cut it the good way or affects if you cut it the bad way. Now he also says there's probably more factors we haven't discovered, but this is what they've been able to identify concretely as this influences the decision for whether you cut this protein in a healthy pattern or whether you cut it in an unhealthy pattern.
Sure. So if indeed this is the case, then in theory, it doesn't matter how advanced you're with Alzheimer's. Technically, if you start addressing these 36, it can potentially be reversed, or is that a very bold statement?
So theoretically, you can take someone from any state and start to reverse it if you understand how it works. Now, practically speaking, the farther you get down the hole, the harder it is. For many, many reasons. Now, that's the case with multiple conditions, so we'd rather catch it early as opposed to late. That's not a revolutionary medical statement, but it is certainly true in Alzheimer's. Now, what's interesting in his book and in his training, he repeatedly says this statement: how many of you know an Alzheimer's survivor? You know, we have other conditions such as cancer, which are terrible conditions, but how many people know a cancer survivor? You know, when we're in a room doing a lecture, or we start to ask these questions, and you have hands go up. How many people know a cancer survivor? We have people raise their hands, and that's terrific. How many people know an Alzheimer's survivor? There's no hands. Dr. Bredesen is the only doctor we've ever seen document now over 100 cases of people with confirmed Alzheimer's who are now actually functioning normal, who now do not fit the diagnostic criteria for Alzheimer's. This is absolutely revolutionary. This, even suggesting that this was possible, you would get laughed at. And this was the same thing Dr. Bredesen had a problem with, was he went to try to get clinical trials done of his theory and what he was doing, and people said, 36 factors? We can only test one. So let me know what the most important one is, and we'll try that. And he said, guys, that won't work. I guarantee it'll fail. You have over 200 clinical trials of drugs trying to address one factor, and they all failed. It's not possible. And they came back with, well, maybe 3. If you can get down to 3, we'll talk. And he said, no, that won't work. But for the first time, to actually see patients get better from Alzheimer's, to think that this is actually possible and there's a method that can be followed, can be reproduced, is extremely exciting. And this is one of the areas Dr. Paul and I are the most excited about as we implement this in practice.